Now, our top story this morning, the healthcare system in the Greater Seoul area is getting dangerously close to breaking point due to the spike in patients critically ill with COVID-19. Health officials in South Korea say they are working on an all-hands-on-deck scenario in a bid to secure more ICU beds.
To fill us in with the latest COVID-19 updates, we have here with us our reporter Kim Yeon-seung. Good morning, Yeon-seung.
Good morning.
Well, so before we get into the overwhelmed ICU beds shortage, let's start with today's numbers. We're expecting it to be around 3,000 again?
Yes, that's right. So we are looking at possibly another day with over 3,000 cases, or somewhere near at least. First, take a look at this past week's COVID-19 tally. So after recording 3,000 cases this Wednesday for the first time in 2 months, as you can see in this graphic here, and for only the second time since the onset of the pandemic, daily COVID infections have stayed above the 3,000 line for a couple of days now. And with health authorities tallying up to almost 2,700 cases last night, there's a high chance that Friday will start off somewhere near that 3,000 mark again. The capital city of Seoul will likely see more than 1,400 cases 3 days in a row, with authorities having traced 1,331 new cases on Thursday night.
And Yeon-seung, do we have any idea about where exactly these infections are springing up from?
Well, care hospitals and nursing homes are actually one of the main hotbeds of the latest virus surge. Currently, 36 care hospitals and 2 nursing homes that have seen infections within their premises are in cohort isolation, meaning the people in there are quarantined together as a group. The 36 care hospitals that have seen up to 1,880 infection cases in total in recent days. Authorities say although it's not time to pull the brakes on easing of COVID-19 restrictions yet, they might zero in on these high-risk facilities and tweak the prevention measures in a way that could put a cap on the source of the outbreak.
Now, Yeon-seung, tell us more on the shortage of the ICU beds in the capital region.
Well, it is a bit concerning because the beds are filling up rather quickly. So as of now, ICU beds in the Seoul capital region are more than 78% full, going up almost 1 to 2 percentage points each day. So more than 400 patients in Greater Seoul were waiting for their beds on Thursday. Prime Minister Kim Yeon-seung is meeting with the directors of general hospitals in the capital region this morning to discuss this urgent issue and ways to expand healthcare capacity in the capital area. The Ministry of Health and Welfare is also due to make an announcement in a few hours to talk about their plan for securing more ICU beds. There was a special message from the Blue House Thursday afternoon as well. President Moon Jae-in urged government officials to work in full force to stabilize the situation and asked them to take special care in acquiring the extra ICU beds. He also added that the road back to normal won't be an easy journey, especially judging by the situation in other countries that have taken this step ahead of South Korea.
So what exactly did President Moon Jae-in mean when he said about other countries starting this journey before South Korea? Did he point out any particular examples?
No, he did not, but let me fill you in with some late updates, the latest updates in Europe. So because most European countries have started months ahead of South Korea in terms of COVID-19 vaccine rollouts, they were also very early in easing the measures as early as this summer. So they did, but things haven't been easy for them since. For example, Germany on Thursday, they reported more than 65,000 cases, breaking through the 60,000 mark for the first time. Germany's top health official warned that the country is in for a very bad Christmas if they don't tighten the measures to dampen the spread. Greece's healthcare sector has also been so overwhelmed with the surge in infection cases that they had to call in doctors from the private sector to help out with the growing number of patients in public hospitals and intensive care wards.
All right. Thank you for the report, Yeon-seung. We will be able to see you next week again, right?
Yes, that's right.
All right. We'll look forward to it.